Systemic racism is killing black people during the pandemic. As COVID-19 infections continue spreading across the country, it's become clear that the burden of coronavirus is not being felt equally across racial lines. According to CDC data on COVID-19 hospitalization during the month of March, 33% of hospitalized patients were black despite only being 18% of the surveyed population. And a recent preprint study from Yale School of Medicine found that blacks had a 3.57 times higher risk of dying from COVID-19 than whites. For Latinos, the risk was 1.88 times higher. It's been noted that blacks and Latinos are more likely to be essential workers, which means they may be at a higher risk for exposure to the coronavirus. But experts say much of the racial disparity being observed in COVID-19 infections and deaths can actually be traced to pre-existing racial inequities related to so-called social determinants of health. Level of educational attainment, neighborhood resources, employment status, and ability to earn a living wage are all social determinants of health in the United States, explains Jesse Marshall, MD, an associate professor at the University of Michigan, adding that racism is driving the racial disparities that we see. Racial inequities lead to higher COVID-19 morbidity. Majority black neighborhoods in the U.S. are more likely to lack access to supermarkets and more likely to have fast food restaurants as compared to majority white neighborhoods, which are both strongly correlated with higher risk of obesity and poorer dietary consumption. Those neighborhoods are also less likely to have the physical infrastructure, such as parks or sidewalks, that promote physical activity. We know that if you're not physically active and you have more of a sedentary lifestyle, that increases your chances of having chronic diseases like obesity and diabetes or high blood pressure, Marshall explained. For example, African Americans are 40% more likely than whites to have high blood pressure and 60% more likely than whites to have been diagnosed with diabetes. Predominantly black neighborhoods also suffer from poor access to health care. Majority African American zip codes are 67% more likely to experience a shortage of primary care physicians. As a result, black Americans are at higher risk for the kinds of chronic diseases that are associated with more severe COVID-19 illness, such as diabetes, obesity, kidney failure, or serious heart conditions. The importance of community health workers during COVID-19 and beyond. Marshall predicts that public health officials will be dealing with COVID-19 for at least 2 years. There are immediate interventions that need to be done to quell these disparities as well as more long-term, post-pandemic interventions to prevent these disparities from happening in the future, she says. One central idea that may provide both short and long-term solutions is to expand the use of community health workers in under-resourced communities. The American Public Health Association defines community health workers as public health workers who are either members of the community being served and/or have a specific understanding of the community. They are lay people who have been trained to provide various services including coaching to improve health behaviors, care coordination, and patient advocacy. Research has repeatedly shown that community health workers play an important role in the lives of disadvantaged patients. In a 2011 study, researchers examined the impact of community health workers on diabetes management among 164 African American and Latino adult participants recruited from health systems in Detroit, Michigan. Members of the intervention group were assigned community health workers who provided diabetes self-management education, regular home visits, as well as accompanying participants to clinic visits during the study period. Participants who were assigned a community health worker showed a reduction in blood glucose levels compared to no change among the control group. Patients who were assigned a community health worker also showed greater improvement in understanding their condition. A bridge between communities and third parties. Bernice Ramallah, Ph.D., who has worked as a community health worker for the United Nations and currently works as a health equity consultant, is currently observing firsthand how community health workers are helping to address coronavirus in vulnerable communities. If you've dealt with systemic racism or encountered issues with navigating the healthcare system, you're not likely to have the same trust level with accessing information from those sources, but you will turn to the community, she says. In the immigrant communities I am working with, the source of information is not the CDC or the World Health Organization. The trusted source of information is myself and other community health workers. There are access barriers in terms of internet access, but there are also questions of whether those sources can be trusted. Community health workers are also able to act as a bridge between communities and third parties. Ramallah recently co-authored a case study detailing how community health workers were able to successfully advocate for COVID-19 testing at a fruit packing plant after being contacted by plant employees who were concerned about spread of the virus. Community health workers have also been effectively utilized to provide instructions to patients on how to properly quarantine. Marshall agrees that community health workers are uniquely positioned to help communicate health information. When you have members of the community talking to fellow community members and delivering public health messages, they're better received and more likely to be adhered to than messages from government institutions, she says. Tackling the underlying systemic racism that causes health inequities. Experts in health equity also want to see more legislative solutions aimed at mitigating the conditions that have led to such high rates of chronic diseases, and therefore a disproportionate burden of COVID-19 complications. Chronic disease can be prevented. It is not inevitable that people will get diabetes or hypertension, says Alicia Fernandez, the director of the Latinx Center of Excellence at the University of California, San Francisco. One step is to improve living conditions in cities, including a living wage so that people can afford better foods. She is also a champion of policies that aim to decrease sugar consumption through taxes on sugar-sweetened beverages. Marshall would also like to see a change in the narrative around racial health disparities. You have government officials and others saying, if black people would eat healthier and exercise more they wouldn't have some of the chronic diseases that put them at higher risk for complications from COVID-19, she explains. That in and of itself is true. However, when you start from that point it gives the false sense that those who are most affected are at fault when in reality they're dealing with disparities, such as food deserts, that are impacting them. Ultimately, experts agree that addressing health inequities will require tackling the underlying systemic racism that caused them. This country was founded on racism and we see the stark realities of how this has even impacted our health system, says Ramallah. Just 100 to 200 years ago, blacks couldn't even see a doctor. We see this perpetuation of the systemic racism and inequities within not only the healthcare system, but within social determinants of health. Thank you for watching. Please subscribe for more videos. World Trends.